My ambition, if you will, my desire is to help our country in whatever role that may be, and I cannot predict what that will be, what doors would be open in the year 2012.
Will you play a major role?
If people will have me, I will.
How's that for not closing any doors? Sarah Palin's media palooza continues.
And I think no matter what she does, a major role is just the least of it. Top Line starts right now.
Hello and welcome to ABCNews.com's Top Line. I'm David Chalian.
And I'm Rick Klein.
Each weekday, we're bringing you the very latest political headlines, reporting, insight, analysis, everything you need and want to know about politics.
And it's twitter.com/thenote. If you want to keep that conversation going all day long, offer questions for our guests, you name it.
Excellent. Rick, kick our Split City edition off. Get us started today. What's your top line?
Palin's principles. Sarah Palin's media blitz is continuing. Barbara Walters interviewing her for Good Morning America, Nightline, and the rest of the ABC programming this week. You'll see lots of Sarah Palin, and you're seeing her begin to engage on current events, talk about some problems she has with the Obama administration, and also engage in no small bit of backbiting when it comes to the campaign. Lots of skeletons in those closets still coming out, and she can't resist the urge once again to tweak Levi Johnston.
Well, that's what's most surprising, I think, about this whole book rollout, Rick, is that she's doing nothing to sort of quiet the tabloid side of Sarah Palin. She's still very much playing up this sort of celebrity aspect apart from her politician in training here. Second up, healthcare hurdles. We have a new ABC News Washington Post poll out that shows really troubling numbers for the White House, Rick. They are showing majorities of Americans are concerned that their personal healthcare costs are going to go up under this plan, as well as costs for the overall system. So basically, these two major principles that the president is trying to sell the country on, majority don't believe they're there.
And we're just not seeing numbers moving in the right direction at all. Of course, the House vote, the Democrats were hoping to use that as a boost, but people aren't buying it when it comes to some of the major principles of this. They're just not buying it, and this is going to be a continuing problem as they try to sell this and get members of Congress who are on the fence to come on board. They don't have the public behind them. Job creation. The numbers are in, and the recovery.gov website tells us of big stimulus job gains in Arizona's 15th congressional district, Northern Mariana Islands' 99th congressional district has lots of stimulus spending. You may know, David, of course, these districts do not exist. There are some 440 phantom districts who are listed on recovery.gov, actually more than the number of real congressional districts. And another black eye for the administration as they try to tell a story about stimulus job creation to try to explain how this website could have such wildly off statistics.
It's unbelievable. It was a fantastic report by our colleague John Carl. And I was thinking last night, Rick, I'm sure you felt the same way. I'm so glad that as we prepare for the midterm elections, we don't have to remember Connecticut's 46th district and who's running there.
And I thought about Jack Abramoff in the Mariana Islands. He did a good job lobbying there.
And of course, the man in charge of the stimulus effort for the White House, TIVO alert. Joe Biden heads to the Daily Show. Could there be a more perfect venue for Joe Biden than Jon Stewart's Daily Show? Literally, he will be there on the set tonight.
Literally, he will, and I'm just guessing he's not going to be interesting at all, David. There's not going to be any clips to play in tomorrow's show from this appearance.
I don't know who's going to be funnier. I don't know if it'll be Joe Biden or Jon Stewart.
Indeed.
Where are we beginning?
I believe we've got Congresswoman Diana DeGette is joining us from Capitol Hill.
Democrat of Colorado. Thank you very much, Congresswoman, for being here. I know you've just gotten into position. We appreciate you running over from your committee hearing. I do want to begin, of course, with the health care vote that happened in the House and this issue of abortion that sort of was a last-minute stumble, it seemed, by the Democrats. The Stupak amendment passed, these restrictions on abortion inside the newly created health care plan should it fully take effect. And Congressman, you've organized sort of the opposition that when this bill comes back, you hope to strip the Stupak amendment from it. But I do want to get a sense from you first what your expectation is of what will happen over in the Senate vis-a-vis this abortion issue.
Well, what happened is after the Stupak Amendment passed, people really realized it was an unprecedented restriction on a woman's right to choose. So now everybody's sort of taking a deep breath and saying, you know, we really don't want to stop people from buying full reproductive care with their own private money. I've been talking to my Senate allies, and I think that they're working on some language to say that in the Senate. So our first step will be the Senate and then the conference report.
Congressman Stupak said this morning on Fox that, that they've got the votes. He says he's counted them. He knows that there's 10, 15, 20 of his colleagues that would vote no if this language is not left intact. He says this battle has already been fought. What's your response?
What I would say is there were 10, 15, 20 people who voted for the Stupak amendment and still voted against the health care bill passage in the House. We still passed the bill.
But these folks who voted for it are absolutely critical. If there's no margin for error in the final vote tally, if any of that number, Stupak and his colleagues vote against it, then the whole bill goes down.
If Congressman Stupak wants to preserve current law, which was the agreement that we had going through committee, then what he does goes far, far beyond that. And most members of Congress, what they want to do is preserve current law.
So you think he doesn't have the votes?
I think he won't have the votes when people explain to him, those members, exactly what the Stupak amendment does.
But some critics say that the Stupak amendment actually does preserve current law, and that many on the abortion rights side of this argument, you included, are looking to expand abortion rights through this health care bill.
That's absolutely not true, because what happened was, in the Energy and Commerce Committee, Mr. Stupak did try his amendment there, and the pro-choice folks and some of the pro-life folks in Energy and Commerce said, look, let's try to find an agreement of current law. So we passed an amendment called the CAPS amendment, which said what the Hyde Amendment says: no federal funds shall be used for abortion. What the Stupak amendment says is if you're in the exchange or if you're in the public option, you still can't buy an insurance policy with your own private money that will cover full reproductive choice. What we said is, look, let's have an agreement. No federal money will be used for abortion. The Stupak amendment goes far, far beyond that.
Congresswoman, is the White House behind you on this right now? Do you have President Obama on your side, Rahm Emanuel on your side, not letting this Stupak amendment be part of the final bill?
Absolutely. Absolutely. This president said last Monday, he said, this is a health care bill. This is not an abortion bill, and we want to make sure that we keep it that way. So they are with me on this.
Congresswoman, why did you vote for the bill if this had this in it? And wasn't the time to fight this out on the House floor as a member of the House?
I was not going to kill health care reform because of this.
But you would on final passage, though?
I felt that that people didn't understand the Stupak amendment, that they thought that it was just the Hyde Amendment, which it's not. And I felt like the bill had many steps to go, and we can fix it. But I'll tell you what, I've had 41 people sign a letter saying, if we don't fix it, if we don't have the final version say that we're preserving current law, we will vote against the final bill. We hope it doesn't come to that.
Those 41 members, though, yourself included, they're saying if this is in there, you will vote to sink health care reform.
No, what we are saying is if the final bill doesn't preserve the status quo, current law, then we will vote against it.
And the Stupak amendment does not.
We still think there's room for negotiation.
But to be clear, the Stupak amendment does not preserve current law in your view.
It's not just my view. The lawyers have said the Stupak amendment goes far, far beyond current law. It prevents people from using their own money to buy these policies.
And Congresswoman, do you sense that the Catholic bishops who were critical in this at the end, they're willing to look at compromised language from the Senate?
I got to tell you, last I heard, we had separation of church and state in this country. I don't think the Catholic bishops are in charge of writing our health care bill. I think that they are one of many groups that we should listen to, but in the end, they should be concerned that 36 million more people in this country will get health care. Many of them are their parishioners.
So do you think Speaker Pelosi and Senator Reid, Mr. Hoyer, involved in these meetings at the last second with the Catholic bishops, were they wrong to be sitting down with the Catholic bishops on the eve of passage?
I'm not going to comment on what happened with the leadership.
Well, you said separation of church and state. That doesn't sound like it when the bishops have a seat at the table at the end. I mean, that was your suggestion.
I've got to say that I think that the Catholic bishops and all of the other groups should have input. But in the end, what we need to do is have health care for 36 million Americans and not take away rights that people have right now to get full reproductive care.
Congresswoman Diana DeGette, Democrat of Colorado, who is fighting this battle on the abortion issue in the health care bill, thank you very much for being with us today.
Good to be with you.
We greatly appreciate it.
Thanks.